Good evening, everybody. Welcome to Dil Se Dil Tak. We are live from the city of Bangalore today. Next, I would like to welcome an eminent cardiologist and personality from Bangalore. He is the Senior Professor of Cardiology, Head of Department of Non-Invasive Cardiology at Sri Jayadav Institute of Cardiovascular Science and Research, which is a top-notch medical institute. So let us welcome Dr. T.R. Raghu. And first we'll see a video introduction on him, and then we'll hear a message from him. Let's see the video.
Fellowship of European Society of Cardiology in the year 2014, Fellow of Society of Coronary Angiology and Interventions in the year 2015. Dr. Raghu has performed over 39,000 coronary angiograms, over 8,500 coronary interventions, including PTCA, stenting, rotablation, and direct stenting, over 3,800 balloon valvuloplasty procedures, such as PTMC, PADV, PTVP and PBPV. He has also performed 100 procedures in congenital heart disease such as pulmonary balloon valvuloplasty, aortic balloon valvuloplasty, coarctation of aorta, PDA and ASD closure. In addition to this, he is a skilled trainer with the merit of training the students on cardiology, acted as an evaluator for evaluation of thesis, for awarding PhD degree from last 3 years for DM cardiology students. Dr. Raghu is also working as MCI inspector for assessing the quality of facilities and training for DM cardiology in various medical colleges of India, and as DM examiner for various medical universities in India for awarding DM degree. In the past, he had worked as member of Credentials Committee of Medical Council of India from 2012 to 2014. Since last 3 years, he is also serving as member of the Super Speciality Board of Shri Rajiv Gandhi University of Health Sciences. actively involved in conducting free monthly cardiac checkup camps in different parts of Karnataka under the auspices of Rotary Club of Channapatna since 1996. Let's listen to Healthy Heart message from Dr. T. R. Raghu.
I am Dr. T. R. Raghu, working as Professor and Head of Department of Cardiology, Sri Jayadeva Institute of Cardiovascular Science and Research. And ours is one of the biggest cardiac centers in India. We see about 7,200 to 2,000 patients in a day. And I have got almost 25 years experience in Jayadeva. As per my experience, commonest risk factor for heart disease, especially heart attack, in India is diabetes, hypertension, smoking, and hyperlipidemia and stress. In part, these are the 5 important risk factors. And of late, pollution has become an important risk factor. People who don't have risk factors, because of pollution, all these microparticles goes to the lungs and goes to the blood vessels and cause there is increasing incidence of cardiovascular disease.
Welcome, Dr. Raghu, to Dil Se Dil Tak. Sir, we have a pertinent question for you. Especially in India, there is a big problem that a lot of young people are developing coronary artery disease. So, what are the factors which are responsible for this? Does genetics have a role to play in this, or is it just the lifestyle which are responsible for development of CAD in the young? Does genetics have a role to play in this?
See, definitely, because whatever the common risk factors, modifiable risk factors play a role, and there are non-modifiable risk factors like age, male sex, and hereditary, and these are all, and familial hyperlipidemia. And to study this premature coronary artery disease, in fact, Jayadeva Institute of Cardiovascular Science started a research on premature coronary artery disease from 2018. My colleague Dr. Raghu is doing a study, and we have included now up to date 2,500. It's a prospective study. It is going to cover genetic markers, going to non-modified risk factors, and we are doing this study in association with St. John's Medical College, Indian Institute of Science, and we are studying the genetic markers in addition to the non-modified risk factors. Whatever the present observation in these 2,500 patients, we saw modified risk factors like diabetes is only 10% of the patient, hypertension is 11% of the patient, and hyperlipidemia is only 13%. And 50% of the patients are smokers in this premature coronary artery disease who are less than 40 years. Another 16% had hereditary family history of coronary artery disease. And 25% of the patients, there were no risk factors. And most of these patients, what we have done, most of them are manual workers, they're drivers, auto drivers, work in industries. And what our postulation probably, the pollution, air pollution is one of the important risk factors. Because these microns, 0.1 micrometers or 2.5 particle matters, they go into the lungs and probably inflammation occurs there. Some minor particles can enter the circulation. It can precipitate atherosclerosis and cause inflammation and cause atherosclerotic plaques and myocardial infarction. And we have studied, actually, WHO has shown that 7 million people are having premature cardiovascular death due to pollution. 7 million people in the world. In fact, in India, 1.6 million people are dying because of pollution. In China, 1.3 million people. Pollution. In fact, Robert Koch is the cholera vaccine founder. He told in 1910 only, we have to fight fiercely pollution as one of the risk factors for cardiovascular events, like we fought for cholera and other pest control diseases. It is going to be true because people who are genetically predisposed, there may be susceptible genes, then environmental factors may play for precipitating atherosclerotic heart disease. And there it is proved actually in various studies, there is increase in pollution, maybe by 5 microns to 10 microns per cubic meter, increases the incidence of cardiovascular events by 5 to 7%. The increased incidence of hypertension, acute cardiovascular events, stroke, arrhythmias, and heart failure.
So the hereditary or the genetics part also has
the environment acts on the genetic factors, both are.
So both are related to each other. So India at this moment we have a problem with both the environment, the diet, and also the.
I think top 10 cities in the world are highly polluted in India. Indian cities are there, I think, out of 20 cities.
Okay, I think the smaller cities will be, they will have less heart attack because of the less pollution over there.
Another lot of studies are there on genetics. Twins, monogenetic twins, and families with coronary arteries, they are more prone for 5 to 7 times more prone for cardiovascular events. And another important factor is maternal. When maternal exposure to pollution, toxins, drugs, when the child are more prone for premature coronary artery disease, they are more prone for diabetes. That's also going to be a big problem.
Malnutrition in the
in the pregnancy, gestational, they are more prone for premature coronary artery disease, more prone for diabetes.
Thank you, Dr. Raghu. I think we have some very important inputs from you. Definitely we'll take it up more in the panel discussion. And thank you.
Thank you.
Yeah.